Hello and welcome to Healthy Outcomes, underwritten by GDIT. I'm your host, George Jackson, with GovExec-TV here in our studios in the Watergate in downtown District of Columbia. Government health organizations are at an inflection point with a new executive order from the Trump administration to make America healthy again. Agencies must modernize healthcare systems with new technology for more resiliency and better data that drive better health outcomes and decrease costs, with the goal of providing better service delivery and access to all. Healthy Outcomes starts right now. Joining us today here on set in those Watergate studios, Dr. Ashwini Davison. She is CMIO for Oncology. For the uninitiated in our audience, that stands for Chief Medical Information Officer over at AWS. Ma'am, welcome.
Thank you.
Also, Kevin Seeley, he's Vice President of Veterans Affairs Business Area over at GDIT. Welcome, sir.
Great.
So, Dr. Davison, kick us off. I teed it up at the top of this program, new executive order out from the Trump administration, making America healthy again, includes a lot. There's info in there on chronic disease prevention, alternative medicine, vaccine safety, reducing pharmaceutical industry influence on healthcare policy, so many other areas. What stood out to you?
Well, George, I think that the focus on moving the conversation in healthcare upstream to preventive care, preventing some of these chronic conditions, and the emphasis on children was really powerful. I think that there is so much that can be done, and a lot of this is dependent on really mobilizing the data that's needed to figure out what some of these causes are of these chronic conditions. And, we know that healthcare generates, so much of the world's data, 36%, yet so much of it is unused. So we really have a lot of potential here to modernize, use some of this digitized data where the focus has been over the past, several decades, to really have an impact upstream instead of focusing on the downstream sick care aspect of things.
This is going to develop, Kevin. I mean, the commission is going to do work. They're going to make recommendations. One thing that I noted in its makeup is one of the people that are at the table with all of those agency heads is the director of OSTP, the Office of Science and Technology Policy. Why is that important, sir?
Well, it's about the data. Right? So you gotta get all the digital pieces together. Taking a step back, we really looked at this is a continuation. The executive order serves as a reminder of the crisis that our country has been in. And we've been investing in technology for about 20 years. Healthcare has been a little bit behind, but they're playing catch up very quickly. And we are now seeing the benefits of having that data by leveraging that in the research and seeing the population health data that we now have. This serves as a reminder, and the Office of Science Technology has to be at the table in order to bring those data pieces together. A lot of times disparate data that's being collected by different agencies. That's where GDIT as an integrator can come in and help actually gather up that data and put it in a cloud environment to help those studies.
It reminds me of something actually that you said before we went on the air. I wrote it down. There's promise in what technology can bring. What did you mean by that, sir?
Well, I was involved in the meaningful use back in the early 2000s, and kind of as a logical step in healthcare is seeing the healthcare data environment mature over the years. Meaningful use was a public and private partnership to get the electronic health record adoption and improve that over the industry. And through the last 15 to 20 years, we've seen a data collection, the digitization of healthcare records that allow the studies and the research and the science to be done. And now those disparate data sources, because originally they were owned and operated by healthcare systems and agencies. Now you're seeing that confluence of data come together in new ways. So we can use things like artificial intelligence, mission artificial intelligence that's use case focused or population based focused. So we can gather insights and make it actionable. I think that's the next step when we're talking about the promise of technology. The next step is achieving the data science piece of all that data gathering we've been doing.
You've sat at that intersection or nexus for a long time, Dr. Davison. I'll note you're an MD. You work at AWS as CMIO, as I said at the top of the program. Johns Hopkins is also a big part of your background. Tie all those elements together for our audience and talk a bit about patient access. What have you learned about patient access?
Sure, George. I think that this concept of moving from meaningful use, when I first came to Hopkins in 2007, right, there were multiple disparate systems that we were using for provider order entry. There were paper notes in some cases. The digitization, the movement towards electronic health records, it's not a lack of data that we're dealing with now. Every hospital on average produces about 50 petabytes of data, if you think about it, right? So the data's there, but it's those silos, right? There's the medical imaging data, medical device data, EHRs, patient-generated health data. Mobilizing all of that is going to be so important to meet the administration's goals. And we can do that. We have options to support researchers. We have options to get that data in more near real time to the providers or the patients that need it the most to make it actionable. So we're really at a tipping point. The digitization's been done, and now this focus on data standards, harmonization, and accessibility is especially important in order to make sure one of the, in the EO, I really liked the emphasis on open source data and transparency and data sharing. And that type of change is what's going to help us all move faster in really moving the needle upstream to prevention, being able to focus on the causative factors so that children don't get those diseases, so they're not burdened for years to come.
I want to ask you to give more color to that EHR, electronic health records question, but I want to give our audience a little bit of context first. Kevin, I promise there is a question at the end of this sort of long-winded intro here, but GDIT is just completing research in partnership with Market Connections. The report, Healthy Outcomes Agency Guide to Health IT Investments, available to the audience for download. It's right in this broadcast platform. But one of the things that it found that I found really interesting is in relative to EHR, that agencies have heavily invested in IT operations and telemedicine, while areas like EHR and 5G have lagged behind a bit, lower investment levels. That stood out to me. Did it surprise you?
A little bit, but there's probably a reason for that. There's a good reason. As we always, as a previous CIO, we always look forward. We're always looking out, seeing what we previously invested in. A lot of that EHR investment, as I said, was made 15 to 20 years ago. So now a lot of those EHRs are now in a sustainment phase. So you got a little bit less investment in the EHR. And then with the COVID-19 issue, the stimulus was, hey, people are going to work remotely, they're going to get care remotely. So they saw an increase in investment in telemedicine and cloud. So cloud consolidates a lot of that data and allows access to care by having the data in a curated place, in a place where it can be hosted and stored and accessed by patients and providers alike. So there's a reason behind that. As you look out at the cycle of investment, you see the cycle of investment being in now cloud is delivering efficiencies. Now they're looking at the next things, IT automation, operations, a lot of security, and of course AI has a lot of promise. So going back to the question about the promise of technology, now we're seeing that confluence of data. We're seeing the ability to actually create AI models that are delivering outcomes to providers and patients alike.
From a mission perspective, what does that result in for an agency or an organization, Dr. Davison? You know, you take electronic health records, you move them securely into the cloud. What can an organization do with that that they weren't able to do before?
That's a great question. I think that what we're really seeing is that moving to the cloud removes some of that undifferentiated heavy lifting. And what it allows for is some of those IT staff to be mobilized and repurposed in a different way. Although EHRs are ubiquitous and we've seen this digitization in healthcare, what's really needed now, a great quote from Bimal Desai, who is the VP and Chief Health Informatics Officer at Children's Hospital of Philadelphia. He says that it's time to automate the boring, right? So within medicine, what we really want to do is make sure that with AI, with the power of the cloud, automate some of the boring. Let folks practice at the top of their license. And that's where we're really going to see some of the efficiency gains that I think we're really at a tipping point for, right, Kevin?
That's right. That's right. So we partner with cloud companies to do exactly that, like AWS. We can actually create those workflow automations in the cloud and make that IT stuff boring, or the process boring, that, you know, get all the administrative stuff actually automated, so that they can actually focus on the patient, they being the providers.
You mentioned security, Kevin, and I've got kind of a two-parter for you here. I get the sense that these health agencies and organizations, based on that 20-year timeline that you outlined, are a little bit behind some other parts of government, or maybe some other parts on the industry side, in doing that and moving information into the cloud, being able to layer on automation and artificial intelligence to really maximize those insights. Is security the real challenge there? I mean, there is a ton of PII, that personally identifiable information type data, that is involved in that process.
Yeah, companies like GDIT actually have what's called digital accelerators. So we'll touch on the Zero Trust. Zero Trust is an architecture that allows tools, very powerful tools, to be utilized in a cloud environment, whether that's data and encryption in storage, you know, or in transit. We actually help design those secure environments. Healthcare has focused really on the last 7 or 8 years on cybersecurity because of a lot of the security incidences that have happened in healthcare. You saw attention pivot to that, but it's absolutely critical for a security issue is critical for our country and for patients to have their data secured, and they have to be confident that it is secure, and so that we have a tremendous focus on making sure that data is secured by applying zero trust principles. And we do that in the cloud. The cloud makes that actually easier to do, rather than having disparate data sources all over and out in on-prem solutions. We can actually secure that in a consolidated way.
Ma'am?
Yeah, one thing that I've noticed that's really changed over the past few years is this conversation about cybersecurity, not just being something that's a focus for the CISO or the CTO, but we're seeing the chief medical officer, the CMIOs interested in this, because cybersecurity downtimes from ransomware, that's a patient safety issue. So uptime is key, and having resilient infrastructure is so important, because when that data or those systems aren't in play, when manual workarounds need to be utilized, that puts patients at risk, and it also increases provider burnout and challenges. And we really, believe that that focus in the more IOs, right? The
more
CMIOs, the CIOs, all focusing on it, and having cybersecurity be top of mind is a significant change that we've seen, and really good progress, because it needs to be. Patient safety is so important.
One related call out, Kevin, for the healthy outcomes study that I referenced earlier is around this concept of privacy. And I've heard You know, it referred to almost as a double-edged sword, technology and privacy and the kind of competing goals or outcomes associated with it. And by that I mean artificial intelligence, for example, has huge promise. You know, to Dr. Davison's point, to streamline things, to take that low-level work and shift it out of people's hands and let them focus on real outcomes. But on the other side, artificial intelligence can also introduce new sort of privacy challenges or hurdles that agencies have to address to make sure that that critical PII or sensitive information is maintained in the right way. How do organizations kind of walk and chew gum at the same time, like introduce these emerging technologies, but also keep that PII where it should be, behind closed doors?
Yeah, that's where the privacy and goes in hand with security. So security is the key kind of piece of the privacy, knowing how to do identity and access management, who's accessing the data at a granular level, and the tools in the cloud environments actually help us do that. Again, back to our digital accelerators, we have identity and access management built into those architectures so that we know who's accessing that data and keeping the patients and providers' interactions secure at all times. That has to be the confidence in our healthcare system, and that's what we build into all of our digital accelerators.
I've heard you refer to this, Dr. Davison, as the other side of the laptop. Past is prologue here. What does that mean?
Right. I think that there's been so much of a focus on modernizing these infrastructures, on digitization, and now we're getting to this time period of really thinking about usability of systems, right? Making the data interpretable. And there's so much potential here, especially with generative AI, that we are thrilled to be, harnessing the power of. Because all that data is there, but we can't have the providers or the patients, the population drowning in that data. And we're seeing some really great examples of harnessing the power of generative AI to make that data easily interpretable, to put it into the hands in a secure way where when we're talking about multimodal data, right? It's not just the EHR data, the genomic data, the imaging data, to pull that full comprehensive view of the patient together. That's a lot of information, but with the power of large language models and foundational models, we can derive insights in a way that's quicker, and hopefully that will be one of the ways in which we're able to make sense of the large troves of data to help identify some of those causative factors as we look towards moving upstream.
Kevin, let's draw this out of the ether for a moment. Skin classification is one area that you called out where it's happening right now. It's really delivering benefits to people.
Yeah, as a great use case, we built a skin lesion classifier that allows for early skin cancer detection, but it uses AI and analyzes the actual diagnostic images for skin lesions, and allows the provider to actually involve an AI to look at the images and help identify things that maybe human beings can't see. So it's a great tool that we've actually built out in a challenge environment to actually deliver something of value, an outcome to a provider and an impact to a patient.
Put on your futurist hat for me. That's a very specific use case, making a difference already. What does that look like in the future, Dr. Davison? What's the state of the art? What's the art of the possible, applying artificial intelligence to all of this health data to improve health outcomes?
I think that what's really great about the potential for AI is that AI won't replace physicians or providers, but physicians and providers that are utilizing AI will replace those that aren't, because they'll be able to move faster, work with more patients, move the conversation upstream, not just focusing on sick care, So I think there's tremendous potential. We see one aspect of that being with large language models being applied on structured or EHR data, but other foundational models that focus on computer vision with imaging data, pathology data, all of that will really have the power to help improve diagnosis, prevent complications, and what I'm really optimistic about is the potential for public-private partnerships to help with drug discovery as well. So there's tremendous potential, and we're seeing examples of this. Last year, we were thrilled to have a $10 million investment in AI for pediatric health. This was an Imagine grant program focused on children's health innovation. And I think over the course of this year, you'll see some of the really great results coming out of that help focus on improving care for children.
Dr. Davison's a perfect example of like a partnership almost in human being form. You know, you've got this MD backgrounds at Johns Hopkins, as I mentioned, over at AWS now. Like, what is it about those good partnerships that make them work, Kevin? What's important to those types of relationships?
Well, we sit down together and understand customers' issues, the challenges that customers are facing together. So good partners actually bring something of value to a customer together. So we call it go-to-market, but ultimately in all the partnerships that GDIT has, we sit down with our partners, our partner vendors, our tool vendors, and we sit down together with the customer to understand the challenges they face and make sure we understand their perspective in going in. Oftentimes we have different perspectives on those challenges and the things that they're facing in their culture or environment in their agency. We sit down to understand those, and we deliver a solution together that meets their need.
One thing we haven't touched on yet, Dr. Davison, is the experiential factor here. You know, call it customer or citizen or patient experience, maybe in this case. You know, you referenced earlier about the changing nature of people's jobs. Maybe there's an employee experience aspect to things, but how is this space, this combination of better data and healthcare, going to result in changes to people's experience of the healthcare system?
I think that it's important, you know, you referred to past is prologue, and, you know, double clicking on that conversation regarding partnerships. A good example would be GDIT and AWS for years really trying to help modernize Center for Medicare, Medicaid services. And that type of history in that partnership where the modernization of that infrastructure is intended to also help the staff, I think is a great example of it, because in healthcare, it's not just about the clinician and the patient in a given setting. There are so many other members of that healthcare team who need to have their experience improved as well. That's important for preventing workforce burnout. It's important for keeping morale high and really for improving efficiency. So where I see all of this going is as we modernize and as we gain efficiency in the systems with automation, it's the patient that will benefit, the provider, but also the nursing staff and the administrators and the others who have been dealing with maybe manual or outdated processes. I see there being benefits for all with automation and AI.
I'd be remiss in my duties, Kevin, if I didn't sort of layer on an access question relative to this. I mean, all three of us live and work in metropolitan DC, one of the most sophisticated healthcare regions in the entire country. Like, what's the future of access to these types of transformative technologies to the healthcare industry?
Well, you're seeing a lot of the technology being extended to the greater population where they didn't have the access for, whether it's on a mobile device or whether it's through a call center, whether it's through extended caregivers, in-home health care. technology that allows us to extend from a cloud environment into the home, where the patient monitoring and in-home healthcare, all of that, again, that's a kind of confluence of care for those that may not be able to get to healthcare or access it, and whether that's could be in a metropolitan area or in a rural area, for that matter. But these technologies now with 5G, extended 5G and wireless, greater accessibility to cell phones, smartphones, greater applications that allow patients to use their cell phones for that care, workflows, automated workflows that enable patients to talk to maybe a nurse via chat that wasn't there before. I'd like to go back real quick, though, to the example that Dr. Davison brought up.
Please.
In the CMS example for automation. You take that huge data set at CMS and analyze it for fraud, waste, and abuse. So there's a business case there as well. We were able to save over $1 billion by analyzing fraudulent claims and looking at the business case. So not only is there an impact to patients and providers, but also the business side to save money and then reinvest those dollars into innovation and technology extended out to access to care type of environments. Telemedicine is a big one. We mentioned COVID, but telemedicine, extending telemedicine capabilities into everybody's environment, completely possible across the country now. Even for those that might be mobile, we go into an encampment that they may not have access to health care. They're out there, could be some homeless population, but you have mobile units that actually go to those encampments and check on people, and they have the ability to uplink and get access to that care. Again, cloud environments enable that, and IT automation enables that.
Ma'am?
When it comes to making the data accessible, one thing that I really think is so important is to know that we've had open data programs for years, and now with the administration's focus on data sharing and making that accessible, it's important to bring attention to resources like the Kids First Data Resource Center that has its data, petabytes of data hosted in the open data program. So I think that as we focus on the data sharing component, I hope that more and more researchers will take advantage of those data sets with multimodal data available on children to study more disease, because in addition to the patient, provider, healthcare worker experience, the researcher's experience is really important as well. We need research, and we need to make sure that the right data is in the hands of the researchers without embargo, and those are some of the initiatives that we've been supporting for a long time, and really are glad that attention's being brought to what's already out there so that people can move faster to help find these causative.
Yeah, and two cases, the great examples, the cancer research that we've done with AWS, GDIT created an environment and brought 25 different data sets together for researchers, and they were able to actually create a flexible cloud environment to index those massive data sets for researchers to do studies on. And then another example of the accessibility, we created an environment in Amazon to actually translate Spanish to Spanish speaking the letters from the Veterans Affairs, their disability letters. So we actually use that automation and natural language processing to create new letters to mail out to those veterans in Puerto Rico. So that's just another example of how it improves access to care by including all that may be beneficiaries of the healthcare system.
I'd like to close this discussion with a broad, open-ended question for you, a bit of a make-your-own adventure. We've referred to this moment in time, Dr. Davison, as a tipping point. Is it? Or am I being a little bit of a sensationalist by referring to it in that way? For healthy outcomes, the IT modernization that's needed to happen in that space, are we at a tipping point?
I think so. I really do think so. I'm optimistic. I feel that there's a confluence of events, the decades of history in trying to digitize, the COVID-19 pandemic being this great accelerant, making individuals realize the importance of having technology be accessible, when needed for remote care. And now we're focusing so much on the data harmonization and the data strategy that needs to be in place to really, take advantage of AI. One thing that I'll say, and I'm so proud of, the partnership that AWS and GDIT have, in order to move fast, partnerships are really important. One can't go it alone, and I think that the history's there, the force and directive is there to really have an impact on health outcomes. And again, like we said at the beginning, it really starts and ends with the data.
Anything you'd like to add on tipping points, something you'd like to reinforce there?
Oh, I share Dr. Davison's optimism. I do think we are at that point where, and all those forcing functions and triggers that have happened in the past, we have this new executive order, just another trigger. You've seen this throughout several administrations now, and I think that there is an appetite for a lot of agencies to do exactly what Dr. Davison and I have described, is to bring that data together. Share that data, have it open source, have it be transparent, de-identified, secured, using AI tools to take not only individual's care to the next level, but the population's care to the next level. I think you see that reflected in the executive order. I would say, we are excited about what comes next in the future. As a previous CIO that's been doing healthcare IT for 30 years, I do think it's time to take it to the next level, and I'm excited about that. And I'd encourage everybody to go out there and read this healthy outcome study, because it really does deliver some insights into where we're going to go next.
I'm excited. Now, after this conversation with Dr. Ashwini Davison, CMIO for Oncology, Amazon Web Services, and Kevin Seeley, VP of Veterans Affairs Business Area over at GDIT, thank you both so much.
Thanks, George.
And thank you, our audience, for watching Healthy Outcomes, Frontline Innovations Driving Health IT Modernization, a GovExec TV program underwritten by GDIT. I hope you learned a thing or two about how IT modernization and cloud adoption continue to improve healthcare systems, better service delivery, secure checkpoints along the way, and where industry and government can come together to help. I'm George Jackson with GovExec TV here at our Watergate studios in Washington, D.C. Have a great day.